The chances of getting cataracts get bigger as you get older. In fact, more than half of all Americans age 80 or older have experienced cataracts.
Cataracts are a general breakdown of the lens that you're born with.
Board-certified ophthalmologist Dr. Jason Williams says the cause of cataracts is simple: age. Like trees develop rings the older they get, our eyes develop layers on the lens.
So when you're born, it's a smaller size, perfectly clear, very flexible. That's why your 5-year-old can sit 6 inches from the TV and doesn't mind at all. But like a tree trunk, you add layers to the lens.
Dr. Williams says eventually the lens can't maintain clarity because there's a browning or yellowing of the lens. He says not only does it affect vision, it can sometimes be visible to others.
Depending on how severe the browning, or sometimes you can actually get a whitening of the cataract, it can be easier to see.
Although most older adults will develop cataracts, some are at risk of developing them earlier.
Smokers are going to develop cataracts at an earlier age. Diabetics are going to develop cataracts at an earlier age. And with diabetics, the less controlled your blood sugar is, the faster it usually tends to develop. Then there are certain medications like systemic steroids that you might be on for certain illnesses that can speed up cataract formation as well.
The good news is cataracts can be removed with surgery.
The surgery is actually very efficient. It's improved over the years. I mean, there are a lot of patients that remember maybe their parents or grandparents having the surgery, where it used to be an overnight stay in the hospital. It involved keeping the head still, putting sandbags on each side of the head so they didn't move around, avoiding heavy lifting or a lot of activities.
Today, the surgery is done on an outpatient basis here in the office and only takes about 15 minutes.
We do it with local anesthesia and sedation, and restrictions are very minimal.
And since the surgery requires replacing the clouded lens with a new one, some patients can ditch their prescription eyeglasses.
There are a multitude of lens options now. It used to be pretty much this is what we have, this is what you get. And so the majority of the time I spend with patients now involve making a decision on what type of vision they want to achieve after the surgery, and then picking the right lens to get that result.
Dr. Williams says it's pretty easy to tell if cataracts are forming in your eyes. For example, the glare from the headlights of other cars at night make it difficult to drive, or it's harder to read books or the words on your TV or phone.
So those are the things that most people will notice first. So if you find yourself turning on every light in the house trying to read something and you're still struggling, or avoiding activities because you know it would cause you to have to drive at night, or needing to get somebody else to drive you, those are some signs that the cataracts may be affecting your vision.
Dr. Williams says the last thing he wants to see are patients unable to enjoy doing the things they love because of their failing eyesight.
The surgeries that we can do can be life-altering, and so it's fantastic when you see somebody come in struggling, maybe bringing somebody who drove them, telling about how they can't really get around their house and they're worried that they may have to go live with a relative or go to a nursing home, and you look and you say, okay, I can restore a lot of your vision.
Providing patients with a new outlook on life, that's why Dr. Williams says he does what he does.